Hello, my name is Lene Hansen, and I am here to present to you some information about the section for orofacial pain and jaw function at the Department of Dentistry and Oral Health at the Faculty of Health of Aarhus University. The section for orofacial pain and jaw function, we used to call it OSK based on the Danish abbreviation, is one of 7 sections at the Department of Dentistry and Oral Health in Aarhus. What we mainly do is we teach dental students, and also, of course, we do research, and then we do patient treatments. So we see patients and diagnose them and manage any condition that they may have on chronic orofacial pain, if they have problems with the jaw joints, the jaw muscles, and the oral mucosa. We see patients with dry mouth and headache and bruxism, that is teeth clenching or grinding, and also we see patients with problems with their bite, what we call occlusal problems, and we receive referrals from all of Denmark for that. Our research themes at our section is, one of the main topics is orofacial pain, and we study different topics underneath that heading. One of them is somatosensory function of the face and mouth. We study chronic pain in the face, mouth and jaws. We study headache conditions, and we also study the autonomic nervous system function in relation to pain. Another main topic is motor function, and for that we study the process of mastication or chewing. We look at different reflexes related to, for example, chewing or to pain responses, and we study clenching or grinding of the teeth and what causes it and how it can be dealt with. And finally, we have a research line on motor learning, for example, training of the tongue and jaw function if in patients who have lost abilities. If you look at some of the things that are highlighted in red here, they are all related to the topic of oral food processing, and this is highly relevant under this research network under the Faculty of Health on food and nutrition. So this is why I have highlighted this in red. The current staff at our section is, I would like to just briefly mention each of us. We have Professor Peter Svensson. He is the person in the red shirt here on the picture. He is a professor and section chair. Then I would like to mention myself, Lene Hansen. I'm associate professor, and I'm also the deputy head for research and talent development of the Department of Dentistry and Oral Health. I represent both our department and the section in the Food and Nutrition Network at Health, and I am the vice president of the network, and also I take a part in the Sustainable Development Goal Network, which is formed between the Natural and Technical Sciences and Health Science at Aarhus University. We have a number of other researchers. We have PhD students, postdocs and guest researchers, and we also have Associate Professor Eduardo Castrillon. And we do a lot of food processing, as you can see here in these pictures. We have a very nice research environment, but also the social environment is quite good. We have 2 really important people also in our section. We have Bente Hausted, who is our research nurse, and we have Hanne Langgaard, our secretary. Without these people, we could not do anything. So in terms of research facilities, we have 4 individual labs. They are all named after what we call scientific giants within the field of orofacial pain and jaw function. And the techniques that we have available is transcranial magnetic stimulation, where we can study what happens in the brain if in patients or in healthy subjects that we submit to motor learning experiences. We have a fully equipped quantitative sensory testing lab, and we also have machines that can evaluate the function of the autonomic nervous system in relation to pain. We have an electromyography and force measurement lab where we can look at all the different motor functions, like, for example, chewing. And then we have a lab dealing with temporomandibular disorders, which is an umbrella term for problems with the temporomandibular joint, the jaw joint, and the muscles that we all use for chewing. And we also have a cognitive behavioral therapy aspect of things, and have at least done some studies on hypnosis and the effect on that on. This is just a picture of some of the techniques that we have available, and some of the references to some studies that we have done. Sensory function, we do a lot in experimental pain models, so we can elicit pain in the muscles and in skin or in the oral mucosa, and we study how that affects oral functions of different kinds. And we can measure bite force using a bite force meter here, and also we can do studies where we track the movements of the lower jaw in 3D space, while we at the same time do electromyography of them and track the muscle activities. It could look like this picture, where we have something on the jaw movements, open and closing the mouth. We have the bite force developments over time, and also we have some EMG signals here from different masticatory muscles, and so we can study these. Our vision is to be one of the world's leading institutions regarding contributions to evidence and knowledge on mechanisms behind assessment, prevention, and management of chronic orofacial pain and dysfunction. And our focus is the patient suffering from problems with different orofacial functions. For example, eating or chewing, swallowing, sensing or tasting, smiling, talking, and opening the mouth. And in order to know something about this dysfunctional aspects, we also study normal physiology in healthy. Other relevant sections at the Department of Dentistry and Oral Health, or the topics that could be interesting in the food and nutrition network, is oral ecology and inflammation. So we have groups dealing with caries, so basically cavities and how they develop and how to avoid them. We have periodontology, which is related to gum disease, which is closely linked to many chronic diseases. Then we have other topics under the heading of function, pain, and rehabilitation. For example, we have a section on prosthodontics that deal with implants and dentures in people who have lost their teeth or some of the jaws. We have our orthodontic section dealing with growth and development disorders and disturbances, and finally we do have an interest in aging aspects of oral function. So if you are interested in collaborating with us, you are very welcome to contact me on this email address, and I will be looking forward to hearing from you. Thank you.